Thank you very much.
For weeks, President Trump has jousted with health officials over the drug hydroxychloroquine to fight coronavirus. The president seems to be a big fan.
What do you have to lose? I'll say it again. What do you have to lose? Take it. I really think they should take it.
But the nation's top infectious disease doctor says we need to study it before we know if it works or not.
There are no proven safe and effective therapies for the coronavirus.
Today, we expect to get a hint as to whether hydroxychloroquine could help treat coronavirus patients. Preliminary results are expected from the first large-scale study of the drug in coronavirus patients. Funded by the state of New York, it involves hundreds of hospitalized patients and was conducted by the University at Albany. New York not only making headway on investigating possible treatments for the coronavirus, but on testing as well.
Extraordinary job.
Governor Andrew Cuomo on Sunday announcing that his state will conduct the largest antibody survey in the nation. If someone has antibodies to COVID-19, it means they were infected and may now be immune.
We'll take thousands of tests, antibody tests, over this next week, all across the state, to give us a real snapshot, a real baseline of exactly how many people were infected by coronavirus.
Public health experts are hoping to eventually conduct widespread antibody testing across the nation. If enough people are immune, then possibly the country could start safely opening up again.
The American Medical Association President, Dr. Patrice Harris, and CNN's Chief Medical Correspondent, Dr. Sanjay Gupta. Dr. Harris, let me read to you what the CDC director has just told the Washington Post. Quote, there's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through. He adds, and when I've said this to others, they kind of put their head back. They don't understand what I mean. Clearly, Dr. Harris, you understand what he means.
I do, Wolf, and that is important information coming from Dr. Redfield. I think physicians are always worried about a second wave, and certainly we knew that if this virus acts like other viruses, we could see a resurgence in the fall. But I have to tell you, I'm also worried about a second wave to come sooner. I'm really worried about those states who are relaxing some of these stay-at-home regulations earlier. We could get a second wave even earlier than the fall. That's very concerning.
And you're talking about Georgia, where you live. That's also where Dr. Sanjay Gupta lives. And I want to get to that in a moment, Sanjay. But the concern is what happens when the coronavirus, according to Dr. Redfield, coincides with the outbreak of flu season here in the United States. How do we use these next few months to prepare, God forbid, for that possibility?
Well, in some ways, it's the same things that we have been talking about for the last few months, Wolf. You know, we've talked about making sure hospitals are adequately prepared in terms of beds and surge capacity and possibly breathing machines. We got to make sure we have enough personal protective equipment. I think there's two things that Dr. Redfield was really pointing out, and he has said this sort of thing before. I think it's taken on a new sense of urgency as people have learned more about the coronavirus. But the constant is the virus. The virus is still out there. It's still very contagious, as Dr. Harris said. That's why she and a lot of other people are worried about a resurgence even sooner. But this time around, the coronavirus outbreak in the United States sort of came as flu season was starting to wane down. If it comes at the same time as flu season, and flu season can oftentimes require, a lot of patients end up going to the hospital, and you need a lot of those same resources that you would need for a coronavirus outbreak in this country. So both those things coinciding would be of concern, and they would both, make us really feel the need for all these same things: the testing, the ventilators, the hospital beds, respiratory therapists, all those things again. And do we have enough? Right now, we sort of feel like, hey, we got through this. The numbers may wane over the summer, but if they come up again in the fall, we have to be prepared.
To know her was to love her.
The love a parent has for their child is precious, instant, eternal. And when they receive that love back, what a mighty feeling that is. You can see the love Skylar has for her mommy and daddy through her beautiful smile and her hugs attached.
She was a beautiful spirit. She was friendly, she was loving, she was caring, she was funny. Just a really happy 5-year-old.
To lose a child at the tender age of 5 is not fair, ever. And to complications from COVID-19. How on earth do you wrap your head, your heart around that?
This is a hurtful feeling that I don't want any other family to have to ever experience.
Skylar passed away at Beaumont Royal Oak Hospital after spending 2 weeks on a ventilator. Skylar tested positive for the coronavirus last month. And not long after, she developed a rare form of meningitis and swelling of the brain.
This virus doesn't care what age you are, what nationality you are, what political preference you have. It's serious and it will devastate you.
Skylar's parents, who both work as first responders in Detroit, mom a police officer, dad a firefighter, have both faced difficult, tough, life-changing situations, but nothing could have ever prepared them for the loss of their baby girl.
Our daughter died so we can let the world really know that a 5-year-old can change the world. We just want to get our message out here.
She was a beautiful little girl. She lived her life. She lived her 5 years. You knew that, she lived a great life in those 5 years.
You're learning that the rapid coronavirus test that the president claimed was a whole new ball game can give inaccurate results. What can you tell us?
Yeah, this is that little machine, point of care machine Daniel just made reference to, that tells you instantly whether or not, or almost instantly, whether or not you have COVID or not. Cleveland Clinic ran some tests on it using this process where you actually take a swab and put it in a vial and then test it, and found it had 15% inaccuracy rate, 15% failure of detecting the COVID virus. That is unacceptable. Abbott immediately notified the FDA and all its customers, Don, which includes the White House, which uses this machine, and told them they can no longer or should no longer use this machine under certain conditions, but to use it only specifically at point of care where you take a specimen from the nose right into the machine. So it just highlights the problems you have when you rush out some of these tests that are going out without all the due diligence and without all the rules and regulations being followed. You kind of have to learn as you go along where mistakes could be made. So hopefully that machine, which is now, I'm sure, in the 700,000 tests already done category, it has now got some new guidelines for how to use it.
This is a very challenging time for us with this coronavirus. We are working nonstop, 24/7. My name's Kelly Morris. I'm the infection prevention nurse here at MedStar Harbor Hospital. We all have microbes and organisms that live on our bodies that normally don't cause harm. But if we're immunocompromised, that's when they can invade in and cause an infection. Hand washing is a far more powerful weapon against germs than many of us realize. The coronavirus is a respiratory virus. It's easily spread. These particles, when we talk, when we sneeze, when we cough, disperse into the air and land on objects, in which we then can pick up. And when we touch our face, if we touch our mouth, if we touch our nose, they can go inside of us. Think of the coronavirus much like a ball filled with genetic information that's surrounded by proteins and lipids. The lipids act like glue, binding it together. When you wash your hands, the soap breaks up this shell of lipids and proteins. When the shell is broken up, the virus dies. Here are a few things that you want to remember when you're going to properly wash your hands. Warm or cold, it doesn't matter. Make sure you wet your hands. Add the soap. And you want to at least wash for 15 to 20 seconds. Apply some friction. We want to remove all those germs. Don't forget in between your fingers and around each nail bed, the back of your hands and the lower portion of your palms. Hand washing is the #1 way in which we can kill this coronavirus. Now we want to flush all those germs down the drain and dry your hands. We need to protect everyone, our loved ones, our parents, our children, our grandparents, as well as ourselves.